Question 1. Performance analysis shows that a client, who is a 75-year-old retired academic with a keen interest in longevity research, is inquiring about a novel, unproven cellular therapy that claims to reverse cellular senescence and extend lifespan. The client has read several articles and is eager to explore this option, believing it could significantly improve their quality of life and cognitive function. As a specialist in gerontology, CSG, how should you ethically and professionally respond to this client's request, adhering strictly to the regulatory framework and guidelines applicable to your practice? Option A. Recommend the unproven cellular therapy based on the client's enthusiasm and the anecdotal claims found in popular literature, as this approach prioritizes client satisfaction and their perceived hope for a breakthrough. Option B. Thoroughly discuss the current scientific understanding of cellular senescence, the evidence, or lack thereof, supporting the proposed therapy, potential risks and benefits, and explore evidence-based interventions that align with the client's goals for improved quality of life and cognitive function, while respecting their autonomy to make informed decisions. Option C. Dismiss the client's interest in the unproven therapy as unrealistic and potentially harmful, and focus solely on standard geriatric care without acknowledging or exploring their specific inquiry. Option D. Immediately agree to facilitate the client's access to the unproven cellular therapy, as their expressed desire and perceived potential benefits outweigh the need for extensive evidence or regulatory approval in this context. The correct answer is B. Thoroughly discuss the current scientific understanding of cellular senescence, the evidence, or lack thereof, supporting the proposed therapy, potential risks and benefits, and explore evidence-based interventions that align with the client's goals for improved quality of life and cognitive function, while respecting their autonomy to make informed decisions. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's expressed desire for a potentially experimental intervention and the gerontologist's ethical obligation to prioritize the client's well-being and autonomy within established scientific and regulatory boundaries. The client's understanding of cellular senescence and its implications for aging may be influenced by popular media or anecdotal evidence, potentially leading to unrealistic expectations or a misunderstanding of the risks and benefits of unproven therapies. The gerontologist must navigate this by ensuring informed consent, assessing the client's capacity to make decisions, and adhering to professional standards of care that emphasize evidence-based practice. The correct approach represents best professional practice because it prioritizes the client's safety and autonomy while upholding scientific integrity. This involves a thorough assessment of the client's understanding, a discussion of evidence-based interventions, and a clear explanation of the limitations and potential risks of experimental approaches. Adhering to the regulatory framework for gerontology, which emphasizes evidence-based practice and client-centered care, is paramount. This approach ensures that the client is empowered to make informed decisions based on accurate information, and that the gerontologist acts within their scope of practice and ethical guidelines. An incorrect approach that involves immediately agreeing to the client's request for an unproven cellular senescence therapy without adequate assessment or discussion of evidence would be a significant regulatory and ethical failure. This would violate the principle of non-maleficence, do no harm, by exposing the client to potential risks without sufficient justification. It would also undermine the principle of autonomy by failing to ensure truly informed consent, as the client's understanding of the intervention's efficacy and safety would be incomplete. Furthermore, it could contravene professional guidelines that mandate the use of evidence-based interventions and discourage the promotion or application of unproven therapies. Another incorrect approach, such as dismissing the client's interest outright without engaging in a dialogue or exploring their motivations, would be ethically problematic. Not directly harmful, it fails to respect the client's autonomy and their right to inquire about potential interventions. This could damage the therapeutic relationship and prevent the gerontologist from identifying underlying concerns or unmet needs that the client hopes to address with the experimental therapy. It also misses an opportunity to educate the client and guide them towards safer, evidence-based options. A third incorrect approach, focusing solely on the scientific literature without considering the client's individual circumstances, values, and preferences, would also be a failure. While scientific evidence is crucial, effective gerontological practice requires a holistic understanding of the client. Ignoring the client's personal context can lead to recommendations that are technically sound, but not practically or emotionally suitable, thereby failing to uphold the principle of beneficence, acting in the client's best interest. Professional decision-making process for similar situations should involve a structured approach. First, actively listen to and understand the client's request and underlying motivations. Second, assess the client's capacity for decision-making and their level of understanding regarding aging and potential interventions. Third, provide clear, evidence-based information about cellular senescence, its role in aging, and the current state of research and therapeutic application, distinguishing between established treatments and experimental approaches. Fourth, discuss the risks, benefits, and uncertainties associated with any proposed intervention, especially those that are not yet widely accepted or regulated. Fifth, collaboratively explore alternative, evidence-based strategies that align with the client's goals and values. Finally, document the entire process thoroughly, including the client's understanding, the information provided, and the agreed-upon plan of care, ensuring all actions are consistent with relevant professional codes of ethics and regulatory requirements. Question 2. Process analysis reveals that a community center is developing a new program to enhance the quality of life for its older adult participants. The program aims to foster a sense of purpose, social connection, and continued engagement in meaningful activities. Considering the diverse theoretical perspectives on aging, which theoretical framework would most effectively guide the development and implementation of such a program to promote successful aging? Option A. A framework that views aging as a period of inevitable cognitive and physical deterioration, leading to a passive role for older adults. Option B. A framework that primarily addresses age-related physiological decline and medical interventions to manage health conditions. Option C. A framework that focuses on maintaining social roles and activities and leveraging past experiences to adapt to new life circumstances. Drawing from activity and continuity theories. Option D. A framework that emphasizes the benefits of social withdrawal and reduced activity in later life, aligning with theories of disengagement. The correct answer is D. A framework that emphasizes the benefits of social withdrawal and reduced activity in later life, aligning with theories of disengagement. Explanation. This scenario presents a professional challenge in applying theoretical frameworks to practical gerontological interventions, requiring a nuanced understanding of how different aging theories inform service delivery. The challenge lies in selecting the most appropriate theoretical lens to guide a program aimed at enhancing the well-being of older adults, ensuring that the chosen approach is not only evidence-based, but also ethically sound and aligned with professional standards for gerontological practice. The correct approach, focusing on the activity theory and continuity theory, represents best professional practice because it acknowledges the importance of maintaining engagement and leveraging past experiences for continued satisfaction in later life. This aligns with professional guidelines that emphasize promoting autonomy, social connectedness, and a sense of purpose for older adults. These theories encourage interventions that support continued participation in meaningful activities and the maintenance of established life patterns, fostering a sense of self and continuity. This is ethically sound as it respects the individual's history and preferences, promoting a positive and dignified aging experience. An incorrect approach that solely emphasizes disengagement theory would be professionally unacceptable. This theory suggests that older adults naturally withdraw from society, and that this withdrawal is beneficial. Basing interventions on this theory could lead to passive approaches that inadvertently isolate older adults, potentially violating ethical principles of promoting well-being and social inclusion. It fails to recognize the diversity of aging experiences and the potential for continued engagement and contribution. Another incorrect approach that prioritizes a purely biological or medical model without considering psychosocial factors would also be professionally flawed. While addressing health needs is crucial, an exclusive focus on biological decline neglects the multifaceted nature of successful aging, which encompasses psychological, social, and environmental aspects. This approach risks overlooking opportunities to enhance quality of life through social support, cognitive stimulation, or meaningful engagement, potentially leading to a less holistic and effective intervention. The professional decision-making process for similar situations should involve a thorough assessment of the target population's needs, preferences, and existing strengths. Professionals should critically evaluate various aging theories, considering their empirical support and ethical implications for intervention design. The chosen theoretical framework should guide the development of person-centered, strengths-based programs that promote active engagement, social connection, and a sense of purpose, ultimately fostering successful aging in a manner that respects individual dignity and autonomy. Question 3. Analysis of a 78-year-old client, Mr. Henderson, who has recently expressed a strong desire to stop attending his weekly support group for individuals experiencing anxiety, stating he doesn't see the point anymore and feels too tired to go. His daughter reports he has become more withdrawn at home, often forgetting appointments and expressing feelings of hopelessness. The gerontological specialist is tasked with determining the most appropriate course of action. Which of the following approaches best aligns with professional gerontological practice and relevant regulatory guidelines? Option A. Advise Mr. Henderson that his feelings are a normal part of aging and encourage him to push through his fatigue to attend the support group for his own good. Option B. Respect Mr. Henderson's stated preference to discontinue the support group immediately as his autonomy is paramount and inform his daughter of this decision. Option C. Schedule a comprehensive assessment with Mr. Henderson to evaluate his current mental health status, including his capacity to make decisions regarding his participation in the support group, and consult with his primary care physician regarding his reported symptoms. Option D. Contact Mr. Henderson's daughter to arrange for him to be enrolled in a more structured day program without further discussion with Mr. Henderson, as his current behavior suggests a decline in his ability to manage his own care. The correct answer is C. Schedule a comprehensive assessment with Mr. Henderson to evaluate his current mental health status, including his capacity to make decisions regarding his participation in the support group, and consult with his primary care physician regarding his reported symptoms. Explanation: this scenario presents a professional challenge due to the complex interplay of an older adult's expressed wishes, potential cognitive impairment affecting decision-making capacity, and the ethical imperative to ensure their well-being and safety. The gerontological specialist must navigate the delicate balance between respecting autonomy and intervening when there is a risk of harm, all within the established regulatory framework. The correct approach represents best professional practice because it prioritizes a comprehensive, person-centered assessment of mental health and decision-making capacity. This aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, as well as the regulatory emphasis on client rights and appropriate assessment protocols. Specifically, it involves a multifaceted evaluation that considers observable behaviors, reported symptoms, and potentially involves consultation with healthcare professionals to accurately diagnose and manage mental health conditions. This systematic approach ensures that interventions are evidence-based and tailored to the individual's specific needs, respecting their dignity and promoting optimal functioning. An incorrect approach that involves immediately overriding the client's stated preference without a thorough assessment of their capacity to make such a decision would be a significant ethical and regulatory failure. This could violate the principle of autonomy, which, while needing to be balanced with safety, is a cornerstone of client care. Furthermore, failing to involve appropriate healthcare professionals or to document the assessment process thoroughly would contravene regulatory requirements for professional conduct and evidence-based practice. Another incorrect approach, such as dismissing the client's concerns as simply old age without further investigation, demonstrates a failure to recognize and address potential mental health disorders, leading to a lack of appropriate support and potentially exacerbating the condition, which is a breach of the duty of care. The professional decision-making process for similar situations should involve a structured approach. First, actively listen to and acknowledge the client's concerns and preferences. Second, conduct a thorough, holistic assessment, including mental health screening and evaluation of decision-making capacity, involving relevant professionals as needed. Third, consult with the client about the assessment findings and collaboratively develop a care plan that respects their autonomy as much as possible while ensuring their safety and well-being. Fourth, document all assessments, discussions, and decisions meticulously, adhering to all relevant legal and ethical guidelines. Question 4. The performance metrics show a significant decline in functional capacity and increased incidence of chronic conditions in a cohort of older adults served by the gerontology practice, considering the established theories of aging, which approach best guides the specialist's interpretation of these trends and subsequent care planning. Option A. Focus interventions on mitigating free radical damage, as the free radical theory is considered the most dominant explanation for cellular aging and associated functional decline. Option B. Conclude that theoretical explanations of aging are too abstract and irrelevant to practical gerontological care, relying solely on observed symptoms for intervention. Option C. Attribute the decline primarily to the wear and tear theory, focusing on the cumulative effects of environmental insults and cellular damage over time. Option D. Prioritize a holistic assessment that integrates an understanding of various aging theories with individual client data, recognizing that no single theory fully explains the observed outcomes. The correct answer is D. Prioritize a holistic assessment that integrates an understanding of various aging theories with individual client data, recognizing that no single theory fully explains the observed outcomes. Explanation. This scenario is professionally challenging because it requires the gerontology specialist to interpret complex biological theories of aging and apply them to observable client outcomes, necessitating a nuanced understanding beyond simple observation. The specialist must distinguish between theoretical explanations and direct clinical evidence, while also considering the limitations of current scientific understanding in gerontology. Careful judgment is required to avoid oversimplification or misapplication of theories. The correct approach represents best professional practice because it acknowledges the multifactorial nature of aging and the limitations of any single theory in explaining an individual's decline. It prioritizes a holistic assessment that integrates theoretical understanding with empirical observation of the client's functional status, health history, and environmental factors. This aligns with ethical principles of person-centered care and evidence-based practice, ensuring interventions are tailored to the individual's unique needs and circumstances, rather than being dictated by a potentially incomplete theoretical framework. Regulatory guidelines for gerontological practice emphasize comprehensive assessment and individualized care planning, which this approach supports. An incorrect approach that focuses solely on the wear and tear theory, attributing all decline to accumulated damage, fails to acknowledge the biological processes of repair and adaptation that occur throughout the lifespan. This can lead to a fatalistic outlook and potentially inappropriate interventions that do not address underlying treatable conditions or promote resilience. Ethically, it risks devaluing the client's agency and potential for improvement. Another incorrect approach that exclusively emphasizes the free radical theory might lead to an overemphasis on antioxidant interventions without considering other significant aging pathways or the client's overall health status. This could result in a narrow focus that neglects other crucial aspects of well-being and may not be supported by robust evidence for all individuals. It risks misallocating resources and potentially causing harm through unnecessary or ineffective treatments, violating the principle of do no harm. A third incorrect approach that dismisses all theoretical explanations as irrelevant to practical gerontological care is also professionally deficient. While direct observation is crucial, understanding the underlying biological theories provides a framework for interpreting observations, predicting potential issues, and guiding research-informed interventions. Ignoring theory can lead to a reactive rather than proactive approach, missing opportunities for preventative care and a deeper understanding of the aging process. This can be seen as a failure to engage with the scientific underpinnings of the profession. The professional decision-making process for similar situations should involve 1. Actively seeking and critically evaluating current scientific literature on aging theories. 2. Conducting a thorough, individualized assessment of the client, considering biological, psychological, and social factors. 3. Synthesizing theoretical knowledge with empirical findings from the assessment. 4. Developing a person-centered care plan that is flexible and adaptable, acknowledging that aging is a dynamic process. 5. Continuously monitoring the client's response to interventions and revising the plan as needed, always grounded in ethical principles and regulatory requirements. Question 5. Process analysis reveals that an older adult who belongs to a cohort that experienced significant economic hardship during their prime working years and had limited access to formal education is now facing challenges accessing community resources and feels socially isolated. Considering the principles of age stratification theory, which of the following approaches best guides the gerontologist's professional response? Option A. Implementing a generic social engagement program that is not specifically designed to address the unique historical and economic context of the individual's cohort. Option B. Advocating for tailored community programs that acknowledge the historical economic disadvantages and educational limitations of this cohort, and actively seeking out resources that address social isolation stemming from these factors. Option C. Recommending individual counseling focused on coping mechanisms for aging and social isolation, without further investigation into the broader societal influences. Option D. Suggesting that the individual's current challenges are a natural consequence of aging and encouraging them to adapt to their circumstances. The correct answer is B. Advocating for tailored community programs that acknowledge the historical economic disadvantages and educational limitations of this cohort, and actively seeking out resources that address social isolation stemming from these factors. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a gerontologist to balance the practical needs of an older adult with the theoretical underpinnings of age stratification. The challenge lies in moving beyond a simplistic view of age as a sole determinant of capability or need, and instead considering the complex interplay of social, economic, and individual factors that influence an older person's position within society. A gerontologist must avoid ageist assumptions and instead advocate for equitable access to resources and opportunities, aligning with principles of social justice and person-centered care. Correct approach analysis. The correct approach represents best professional practice because it directly applies the principles of age stratification theory to advocate for the older adult's needs within their specific social context. This involves recognizing that societal structures and historical cohort experiences, e.g., economic downturns, educational access, have shaped the resources and opportunities available to this individual and their peers. By advocating for tailored support that addresses these systemic disadvantages, the gerontologist is upholding ethical obligations to promote well-being and social inclusion, as well as adhering to professional guidelines that emphasize understanding the multifaceted nature of aging. This approach acknowledges that disparities in later life are often rooted in earlier life experiences and societal positioning, not solely individual decline. Incorrect approach is analysis. One incorrect approach fails by focusing solely on the individual's current perceived limitations, without considering the broader societal factors that may have contributed to those limitations. This approach risks perpetuating ageist stereotypes and overlooks the systemic inequalities that age stratification theory highlights. It is ethically problematic as it does not advocate for the individual's full potential or address underlying social determinants of health and well-being. Another incorrect approach is to dismiss the individual's concerns as simply a consequence of aging, without investigating the social or economic context. This approach ignores the core tenets of age stratification theory, which posits that age is not just a biological marker but a social one, influencing access to resources and power. Ethically, this is a failure to provide comprehensive and person-centered care, leading to potential neglect of unmet needs. A further incorrect approach might involve applying a one-size-fits-all intervention, without considering the unique cohort experiences or social positioning of the older adult. This fails to acknowledge the heterogeneity within older populations and the impact of historical and social stratification on individual circumstances. It is professionally unsound, as it lacks the nuanced understanding required to effectively support older adults and may lead to ineffective or even detrimental interventions. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the individual's circumstances, encompassing not only their immediate needs, but also their life history, social connections, economic status, and historical cohort experiences. This assessment should be guided by theoretical frameworks such as age stratification theory to understand how societal structures have influenced the individual's current position. The next step involves identifying potential barriers and facilitators to well-being, considering both individual factors and systemic influences. Finally, professionals should develop and advocate for interventions that are tailored to the individual's unique situation, promoting empowerment, equity, and social inclusion, while continuously evaluating their effectiveness and making adjustments as needed. Question 6. Research into the impact of genetic factors on age-related diseases has revealed significant predispositions. A gerontologist is working with an older adult client who expresses a vague concern about family health issues, but is hesitant to discuss specifics. What is the most appropriate approach for the gerontologist to take regarding the client's potential genetic predispositions? Option A. Advise the client that genetic factors are complex and often not directly actionable in later life, and therefore, it is best to focus on current lifestyle and environmental influences rather than exploring family health history. Option B. Gently explore the client's specific concerns about family health issues and their interest in understanding how genetic factors might relate to their personal health and care planning, offering information and resources only if the client expresses a clear desire to proceed. Option C. Document the client's vague concern about family health issues and proceed with standard care protocols without further inquiry into genetic factors, as the client has not explicitly requested genetic information. Option D. Immediately initiate a comprehensive genetic screening based on general predispositions for age-related diseases, assuming that any mention of family health issues indicates a need for detailed genetic information. The correct answer is B. Gently explore the client's specific concerns about family health issues and their interest in understanding how genetic factors might relate to their personal health and care planning, offering information and resources only if the client expresses a clear desire to proceed. Explanation. This scenario presents a professional challenge due to the sensitive nature of genetic information and its implications for an older adult's well-being and autonomy. The gerontologist must navigate the ethical imperative to respect the client's wishes, while also considering potential benefits and risks associated with genetic factors that might impact their health and care planning. Careful judgment is required to balance informed consent, privacy, and the pursuit of optimal health outcomes for the aging individual. The correct approach represents best professional practice because it prioritizes the client's autonomy and right to self-determination. By focusing on the client's expressed concerns and preferences regarding genetic factors, the gerontologist ensures that any exploration or intervention is driven by the client's needs and values. This aligns with ethical guidelines that emphasize person-centered care and respect for individual choice. Furthermore, it allows for a tailored approach to genetic information, ensuring that it is presented and discussed in a manner that is understandable and relevant to the client, avoiding unnecessary anxiety or distress. This approach is supported by principles of informed consent, where individuals have the right to decide what information they wish to receive and how it is used in their care planning. An incorrect approach that focuses solely on identifying all potential genetic predispositions without the client's explicit consent or expressed interest would be a significant regulatory and ethical failure. This would violate the client's right to privacy and could lead to the disclosure of sensitive information without their permission, potentially causing undue stress, discrimination, or unwanted medical interventions. Another incorrect approach that dismisses the client's concerns about genetic factors, deeming them irrelevant to their current care, would fail to acknowledge the holistic nature of gerontological care and the potential long-term impact of genetic predispositions on an individual's health trajectory. This could lead to suboptimal care planning and a missed opportunity to proactively address potential health risks. The professional decision-making process for similar situations should involve a thorough assessment of the client's expressed needs and concerns. This includes actively listening to their questions and anxieties, particularly regarding genetic factors. The gerontologist should then explore the client's understanding of genetic influences on health and their willingness to engage with this information. If the client expresses interest, the gerontologist should provide clear, accessible information about relevant genetic factors, their potential implications, and available resources, always respecting the client's right to refuse further exploration or intervention. The process must be guided by principles of autonomy, beneficence, non-maleficence, and justice, ensuring that the client's best interests are served while upholding their rights and dignity. Question 7. The audit findings indicate a significant variation in the availability and accessibility of community-based palliative care services for older adults with chronic illnesses across different health service areas. Considering the regulatory framework governing gerontological care and healthcare policy within this jurisdiction, Which of the following approaches would be most appropriate for addressing these disparities? Option A. Focus on increasing the number of gerontology specialists in the underserved areas without a concurrent review of the underlying healthcare policies and service structures. Option B. Conduct a comprehensive comparative analysis of the healthcare policies, funding models, and service delivery frameworks for community-based palliative care in the affected health service areas to identify systemic factors contributing to the observed variations. Option C. Recommend that older adults in areas with limited services explore alternative care options, such as relocating to areas with better access to palliative care. Option D. Advise individual healthcare providers in underserved areas to independently seek additional funding and resources to expand their palliative care services. Correct answer is B. Conduct a comprehensive comparative analysis of the healthcare policies, funding models, and service delivery frameworks for community-based palliative care in the affected health service areas to identify systemic factors contributing to the observed variations. Explanation. The audit findings indicate a potential disparity in the provision of home-based care services for older adults across different geographic regions within the jurisdiction. This scenario is professionally challenging because it requires a nuanced understanding of healthcare systems and policy, specifically how these systems are designed to ensure equitable access and quality of care for a vulnerable population. Professionals must navigate complex policy landscapes, consider resource allocation, and advocate for patient needs while adhering to regulatory frameworks. The correct approach involves a comparative analysis of existing healthcare policies and their implementation across the identified regions. This approach is best professional practice because it directly addresses the audit findings by examining the root causes of any observed disparities. It aligns with the ethical imperative to promote health equity and ensure that all older adults, regardless of their location, receive appropriate and timely care. This involves reviewing relevant legislation, policy guidelines, and service delivery models to identify best practices and areas for improvement. Such an analysis would likely involve examining funding mechanisms, provider qualifications, service availability, and patient outcomes, all within the established regulatory framework for gerontological care. An incorrect approach would be to dismiss the findings without further investigation, assuming that any observed differences are simply due to local variations and do not warrant systemic review. This fails to acknowledge the professional responsibility to identify and address potential inequities in care. Another incorrect approach would be to focus solely on anecdotal evidence or individual patient complaints without a systematic policy analysis. While individual experiences are important, they do not provide the comprehensive understanding needed to address systemic issues. A further incorrect approach would be to propose solutions that are not grounded in the existing regulatory framework or that do not consider the broader policy implications for the healthcare system. This could lead to ineffective or even non-compliant interventions. Professionals should employ a decision-making process that begins with a thorough understanding of the audit findings and the relevant regulatory environment. This involves gathering data, conducting a systematic comparative analysis of policies and practices, identifying the underlying causes of disparities, and then developing evidence-based, policy-informed recommendations. This process prioritizes patient well-being, adherence to regulations, and the promotion of equitable access to quality care for older adults. Question 8. Quality control measures reveal that a gerontology specialist is working with an older adult client who expresses feelings of regret about past life choices and a sense of dissatisfaction with their current social engagement. The specialist is considering how to best support this client. Which of the following approaches best aligns with the ethical and professional standards for gerontological practice, focusing on psychological theories of aging? Option A. Dismiss the client's expressed feelings of regret as simply a manifestation of a theoretical stage of aging that they are experiencing, and proceed with interventions based solely on activity theory without further exploration of the client's subjective experience. Option B. Advise the client that feelings of regret and reduced social engagement are common and often inevitable aspects of aging, suggesting that they should focus on accepting these changes to find peace. Option C. Encourage the client to reevaluate their past choices through the lens of continuity theory, emphasizing that their current behaviors are a direct and predictable outcome of their lifelong patterns, and suggest they should adjust their expectations accordingly. Option D. Explore the client's feelings of regret and dissatisfaction by discussing their life narrative through the lens of Erickson's stages of psychosocial development, specifically focusing on the potential for achieving ego integrity, and collaboratively identify strategies to enhance current social engagement that align with the client's interests and capabilities. Correct answer is D. Explore the client's feelings of regret and dissatisfaction by discussing their life narrative through the lens of Erickson's stages of psychosocial development, specifically focusing on the potential for achieving ego integrity, and collaboratively identify strategies to enhance current social engagement that align with the client's interests and capabilities. Explanation: this scenario is professionally challenging because it requires a gerontology specialist to balance the practical application of psychological theories of aging with the ethical imperative to respect individual autonomy and dignity. The specialist must discern how to best support a client's well-being without imposing a theoretical framework that might inadvertently limit their perceived choices or devalue their lived experience. Careful judgment is required to ensure that interventions are client-centered and evidence-based, aligning with the principles of person-centered care often emphasized in gerontological practice. The correct approach represents best professional practice because it prioritizes the client's subjective experience and self-perception, while integrating relevant psychological theories to inform understanding and support. This aligns with ethical guidelines that mandate respecting the autonomy and dignity of older adults. By focusing on the client's narrative and using theories like Erickson's stages of psychosocial development, e.g., integrity vs. despair, or activity theory, as lenses for interpretation rather than prescriptive frameworks, the specialist can foster a sense of empowerment and validation. This approach acknowledges that individuals may integrate or reject theoretical constructs based on their personal journey, and the specialist's role is to facilitate this process, not dictate it. An incorrect approach that focuses solely on applying a single psychological theory rigidly, such as disengagement theory, would be professionally unacceptable. This would represent an ethical failure by potentially imposing a negative stereotype on the client, suggesting that withdrawal is an inevitable or desirable outcome of aging, thereby undermining their sense of agency and potentially leading to social isolation. Another incorrect approach that dismisses the client's expressed feelings or experiences because they do not neatly fit a particular theory would be a failure to uphold the ethical principle of respecting individual dignity and autonomy. It would also be a failure to engage in a holistic assessment, which is a cornerstone of gerontological practice. A third incorrect approach that prioritizes the specialist's theoretical preferences over the client's expressed needs and goals would be a breach of professional ethics, demonstrating a lack of client-centeredness and potentially leading to ineffective or harmful interventions. Professionals should employ a decision-making framework that begins with active listening and empathetic engagement with the client's narrative. This involves understanding their current life situation, their past experiences, and their aspirations for the future. Subsequently, relevant psychological theories of aging should be considered as potential frameworks for understanding the client's experiences, but always with the understanding that these are tools for interpretation, not definitive explanations. The specialist must then collaboratively determine, with the client, how these theoretical insights can inform strategies to enhance their well-being, respecting their choices and preferences throughout the process. This iterative approach ensures that interventions are both theoretically informed and ethically grounded in client autonomy and dignity. Question 9. Which approach would be most effective for a specialist in gerontology, CSG, to evaluate current and future population aging trends to inform strategic planning for elder care services? Option A. Relying solely on historical population aging trends from the past 50 years without considering current or future projections. Option B. Analyzing a combination of current life expectancy, the proportion of the population aged 65 and over, and projected demographic shifts for the next 2 decades. Option C. Utilizing only the old age dependency ratio as the primary statistical measure. Option D. Focusing exclusively on the absolute number of individuals aged 65 and over in the most recent census data. The correct answer is B. Analyzing a combination of current life expectancy, the proportion of the population aged 65 and over, and projected demographic shifts for the next 2 decades. Explanation: scenario analysis. This scenario is professionally challenging because it requires a gerontology specialist to interpret and apply population aging statistics to inform policy and program development. The challenge lies in selecting the most appropriate statistical approach that accurately reflects demographic trends without oversimplifying complex data or leading to misinformed decisions. The specialist must consider the nuances of different statistical measures and their implications for resource allocation and service design for an aging population. Correct approach analysis. The correct approach involves utilizing a combination of demographic indicators that provide a comprehensive picture of population aging. This includes examining trends in life expectancy, the proportion of the population aged 65 and over, and projections for future demographic shifts. Such an approach is best professional practice because it aligns with the principles of evidence-based practice in gerontology, which emphasizes the use of robust data to guide interventions. Regulatory frameworks and ethical guidelines for gerontology specialists often mandate the use of accurate and comprehensive data to ensure the well-being of older adults and the efficient use of resources. By considering multiple indicators, the specialist can identify emerging needs, anticipate future challenges, and develop targeted strategies that are both effective and ethically sound, thereby fulfilling professional obligations to the aging population. Incorrect approaches analysis. Focusing solely on the absolute number of older adults without considering the proportion of the population or projected growth is an incomplete statistical approach. This failure to contextualize the data can lead to an underestimation or overestimation of the impact of aging on society and resource needs, potentially violating ethical obligations to accurately represent demographic realities. Relying exclusively on historical trends without incorporating future projections ignores the dynamic nature of population aging and can result in policies that are quickly outdated, failing to meet the evolving needs of the aging population and contravening best practices in forward-looking gerontological planning. Using only a single demographic metric, such as the dependency ratio, without corroborating it with other indicators like life expectancy or age-specific mortality rates, presents a narrow and potentially misleading view. This can lead to flawed policy recommendations and misallocation of resources, which is ethically problematic as it may not adequately address the multifaceted needs of older adults. Professional reasoning. Professionals in gerontology should adopt a systematic approach to data analysis. This involves first clearly defining the objective of the statistical analysis, e.g., informing policy, program planning, resource allocation. Subsequently, they should identify relevant demographic indicators that directly address the objective, considering both current status and future trends. A critical step is to evaluate the strengths and limitations of each indicator, and to select a combination of metrics that provide a holistic and accurate representation of the population aging phenomenon. This multi-indicator approach ensures that decisions are grounded in comprehensive and reliable data, thereby upholding professional standards and ethical responsibilities. Professionals must also be prepared to critically assess the data sources and methodologies used to generate statistics, ensuring their validity and applicability to the specific context. Question 10. The review process indicates that a gerontological specialist is providing care to an older adult from a different cultural background. The specialist has some general knowledge about the client's cultural group, but has not yet engaged in a detailed discussion about the client's personal beliefs and practices related to health and aging. Which of the following approaches best reflects culturally competent practice in this situation? Option A. Proceed with the care plan based on general knowledge of the client's cultural group, assuming their beliefs and practices align with common cultural norms. Option B. Avoid discussing cultural factors to prevent potential misunderstandings or discomfort, focusing solely on the clinical aspects of care. Option C. Rely on family members to provide all information regarding the client's cultural beliefs and practices without directly engaging the client. Option D. Initiate a conversation with the client to explore their specific beliefs, values, and practices regarding health, illness, and aging, and integrate this understanding into the care plan. The correct answer is D. Initiate a conversation with the client to explore their specific beliefs, values, and practices regarding health, illness, and aging, and integrate this understanding into the care plan. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent diversity within the aging population and the potential for implicit biases to negatively impact care delivery. A gerontological specialist must navigate cultural nuances, communication styles, and differing health beliefs to provide effective and respectful care. Failure to do so can lead to misdiagnosis, non-adherence to treatment plans, and a breakdown in the therapeutic relationship, all of which are ethically and professionally unacceptable. Correct approach analysis. The correct approach demonstrates a commitment to culturally competent care, which is a cornerstone of ethical gerontological practice. This involves actively seeking to understand the client's cultural background, beliefs, and values, and integrating this knowledge into the assessment and care planning process. This aligns with the principles of person-centered care and respect for autonomy, ensuring that interventions are not only clinically sound, but also culturally appropriate and acceptable to the older adult. This proactive engagement with cultural factors is essential for building trust and fostering effective communication, directly impacting the quality and efficacy of care. Incorrect approaches analysis. One incorrect approach involves assuming that all older adults from a particular cultural group share identical beliefs or practices. This is a form of stereotyping and demonstrates a lack of cultural humility, leading to a failure to recognize individual differences within cultural groups. This can result in care plans that are irrelevant or even offensive to the client, violating principles of respect and dignity. Another incorrect approach is to rely solely on generalized cultural information without direct engagement with the individual. While general knowledge can be a starting point, it is insufficient for providing personalized care. This approach risks imposing external assumptions onto the client, rather than understanding their unique perspective and needs. It fails to acknowledge the dynamic and individual nature of culture and its impact on health. A third incorrect approach is to avoid discussing cultural factors altogether, perhaps due to discomfort or a belief that it is not relevant to clinical care. This avoidance creates a barrier to understanding the client's holistic needs and can lead to misunderstandings or a lack of engagement with the care plan. It represents a failure to provide comprehensive and sensitive care, neglecting a crucial dimension of the older adult's well-being. Professional reasoning. Professionals should adopt a framework of cultural humility, which involves a lifelong commitment to self-evaluation and self-critique. This means acknowledging one's own biases, being open to learning from others, and actively seeking to understand the client's cultural perspective. When faced with a situation involving cultural considerations, the professional should initiate open-ended conversations about beliefs, values, and practices related to health and aging. They should then integrate this information into a collaborative care plan, ensuring the client feels heard, respected, and empowered in their healthcare decisions. Question 11. The analysis reveals that an older adult, diagnosed with moderate Alzheimer's disease, is expressing a desire to continue living independently in their home, despite evidence of increasing safety concerns and challenges with daily living activities. The professional team is divided on how to proceed with the decision-making process regarding their living situation. Which of the following approaches best aligns with the regulatory framework and ethical guidelines for specialists in gerontology? Option A. Immediately arrange for a move to a residential care facility, as the diagnosis of Alzheimer's disease inherently implies a lack of capacity for independent living, and the safety concerns present an immediate risk. Option B. Proceed with implementing safety modifications in the home based on the professional team's assessment of risks, without further discussion or assessment with the individual, as their cognitive impairment makes them incapable of contributing meaningfully to this decision. Option C. Initiate a formal capacity assessment to determine the individual's ability to understand the risks and benefits of independent living, and involve them in the decision-making process to the greatest extent possible, seeking input from family and support services to explore options that support their autonomy while ensuring safety. Option D. Defer the decision entirely to the individual's adult children, assuming they will make the best choices for their parents' well-being without direct professional assessment of the individual's current wishes or capacity. The correct answer is C. Initiate a formal capacity assessment to determine the individual's ability to understand the risks and benefits of independent living, and involve them in the decision-making process to the greatest extent possible, seeking input from family and support services to explore options that support their autonomy while ensuring safety. Explanation. This scenario is professionally challenging due to the inherent vulnerability of individuals experiencing cognitive impairments, such as dementia. The core challenge lies in balancing the individual's right to autonomy and self-determination with the need to ensure their safety and well-being. Professionals must navigate complex ethical considerations, including informed consent, capacity assessment, and the potential for undue influence or exploitation. The specific regulatory framework for the specialist in gerontology, CSG, exam dictates that all decisions must prioritize the dignity, rights, and best interests of the older adult, while adhering to established professional standards and legal requirements. The correct approach represents best professional practice because it involves a systematic and person-centered process. It begins with a thorough assessment of the individual's cognitive capacity, recognizing that capacity can fluctuate and is specific to the decision at hand. This assessment should be conducted by qualified professionals using validated tools and techniques, and should involve the individual to the greatest extent possible. When capacity is diminished, the process shifts to involving appropriate surrogate decision-makers, such as family members or legal guardians, who are guided by the individual's known wishes, values, and preferences. This approach aligns with the ethical principles of beneficence, acting in the person's best interest, and non-maleficence, avoiding harm, while respecting the individual's remaining autonomy. It also adheres to regulatory guidelines that mandate person-centered care and the protection of vulnerable adults. An incorrect approach that fails to conduct a formal capacity assessment before proceeding with significant life decisions for an individual with suspected cognitive impairment is a significant regulatory and ethical failure. This bypasses a fundamental requirement to determine if the individual can understand the information relevant to the decision, appreciate the consequences, and communicate their choice. This can lead to decisions being made that are not in the individual's best interest or that violate their previously expressed wishes, thus breaching the principle of autonomy and potentially leading to harm. Another incorrect approach, such as solely relying on the opinions of family members without any professional assessment of the individual's capacity or their own expressed wishes, is also ethically and regulatorily problematic. While family input is valuable, it cannot substitute for a professional determination of capacity or the individual's own voice. This can lead to decisions being made based on the family's perceptions rather than the individual's actual desires or best interests, potentially leading to conflict and distress for the older adult. It also fails to uphold the regulatory requirement for objective assessment and evidence-based decision-making. A third incorrect approach, such as making assumptions about an individual's wishes based on their diagnosis of dementia without engaging in direct communication or seeking clarification, is also a failure. Dementia does not automatically negate an individual's ability to express preferences or make certain decisions. Professionals have a duty to explore all avenues to ascertain the individual's wishes, even if communication is challenging. This approach disregards the principle of respecting individual dignity and the right to self-expression, and can lead to a loss of control and agency for the older adult. The professional decision-making process for similar situations should involve a structured approach. 1. Initial observation and concern. Recognize signs of potential cognitive impairment that may affect decision-making. 2. Information gathering. Collect relevant information about the individual's history, current condition, and any previously expressed wishes. 3. Capacity assessment. Conduct a formal professional assessment of the individual's capacity to make the specific decision in question. This is a critical step. 4. Consultation. If capacity is diminished, consult with appropriate individuals, including family, legal guardians, and other healthcare professionals. 5. Decision-making. Based on the capacity assessment and consultation, make a decision that prioritizes the individual's best interests, dignity, and autonomy in accordance with relevant regulations and ethical guidelines. 6. Documentation. Thoroughly document all assessments, consultations, and decisions made. 7. Ongoing review. Recognize that capacity can change and be prepared to reevaluate decisions as needed. Question 12. Cost-benefit analysis shows that increased immigration of older adults presents both opportunities and challenges for national aging infrastructure. A specialist in gerontology, CSG, is tasked with advising policymakers on strategies to optimize the integration of this demographic. Which of the following approaches best reflects a comprehensive and ethically sound strategy for addressing the impact of immigration on aging within the regulatory framework for the CSG exam? Option A. Implement a one-size-fits-all approach to aging services, assuming that the needs of older immigrants are identical to those of the established aging population, and prioritize assimilation over cultural preservation. Option B. Advocate for stricter immigration controls on older adults to alleviate immediate pressure on healthcare and social services, focusing resources exclusively on the needs of the native-born aging population. Option C. Develop targeted programs and policies that acknowledge and address the unique cultural, linguistic, and health needs of older immigrants, while simultaneously exploring innovative service delivery models and leveraging the potential contributions of this demographic to the broader society. Option D. Focus solely on the potential economic strain of supporting an aging immigrant population, recommending significant cuts to social programs without considering the economic contributions or the ethical implications of such actions. Correct answer is C. Develop targeted programs and policies that acknowledge and address the unique cultural, linguistic, and health needs of older immigrants, while simultaneously exploring innovative service delivery models and leveraging the potential contributions of this demographic to the broader society. Explanation: this scenario is professionally challenging because it requires a gerontology specialist to navigate the complex interplay of social, economic, and health-related factors impacting an aging population, specifically through the lens of immigration. The specialist must consider not only the direct needs of older immigrants, but also the broader societal implications and the ethical considerations of resource allocation and service provision. Careful judgment is required to balance the benefits of immigration for the aging demographic with the potential strains on existing infrastructure and support systems, all while adhering to the specific regulatory framework for the specialist in gerontology, CSG exam. The correct approach represents best professional practice because it prioritizes a holistic and evidence-based understanding of the impact of immigration on aging. It emphasizes the need for data-driven policy recommendations that consider both the contributions and challenges associated with older immigrants. This aligns with the CSG's mandate to promote the well-being of older adults through informed practice and advocacy, grounded in a comprehensive understanding of demographic shifts and their consequences. Ethical considerations, such as ensuring equitable access to services and respecting cultural diversity, are implicitly embedded in this approach. Incorrect approaches fail to meet professional standards by either oversimplifying the issue, focusing on a single aspect without considering the broader context, or proposing solutions that are not grounded in evidence or ethical principles. One incorrect approach might focus solely on the perceived economic burden, without acknowledging the economic contributions of older immigrants or the potential for innovation and workforce participation. Another might overlook the unique cultural and linguistic needs of older immigrant populations, leading to the development of services that are inaccessible or inappropriate. A third incorrect approach might advocate for policies that are discriminatory or fail to uphold the rights and dignity of older immigrants, violating fundamental ethical principles in gerontology. Professional decision-making in similar situations requires a systematic process. First, thoroughly understanding the specific regulatory framework and ethical guidelines applicable to gerontology practice. Second, gathering comprehensive data from diverse sources, including demographic trends, health statistics, economic indicators, and qualitative research on the lived experiences of older immigrants. Third, critically analyzing this data to identify both challenges and opportunities. Fourth, developing evidence-based recommendations that are culturally sensitive, ethically sound, and aligned with the goals of promoting the well-being of all older adults. Finally, advocating for the implementation of these recommendations through appropriate channels. Question 13. The control framework reveals that a gerontological specialist is evaluating different biological theories of aging to inform their client education materials. Which of the following theoretical frameworks is most consistently supported by current scientific evidence and widely accepted within the field of gerontology? Option A. The theory that aging is a direct result of the body's programmed genetic clock, where specific genes are activated or deactivated at predetermined times to initiate the aging process. Option B. The theory that aging is primarily caused by the accumulation of cellular damage due to free radicals and oxidative stress, leading to impaired cellular function and eventual organismal decline. Option C. The theory that aging is a consequence of the gradual accumulation of errors in protein synthesis and DNA replication, leading to a progressive loss of cellular fidelity. Option D. The theory that aging is a result of the body's immune system mistakenly attacking its own healthy cells, similar to autoimmune diseases. The correct answer is B. The theory that aging is primarily caused by the accumulation of cellular damage due to free radicals and oxidative stress, leading to impaired cellular function and eventual organismal decline. Explanation: the control framework reveals that understanding the biological theories of aging is fundamental for gerontological specialists to provide evidence-based care and interventions. This scenario is professionally challenging because it requires distinguishing between established scientific theories and speculative or unproven hypotheses, ensuring that professional recommendations are grounded in robust evidence and align with the ethical imperative to provide accurate information to older adults and their families. Careful judgment is required to avoid promoting misinformation or interventions based on flawed theoretical underpinnings. A correct approach represents best professional practice because it focuses on theories that have significant empirical support and have shaped current understanding and research in gerontology. These theories, such as the free radical theory and the telomere shortening theory, offer plausible mechanisms for cellular and molecular damage that contribute to the aging process. Adhering to these well-researched theories ensures that interventions and advice are aligned with scientific consensus, promoting effective and ethical care. This aligns with the professional responsibility to base practice on the best available evidence, as often stipulated in professional codes of conduct and regulatory guidelines for gerontological practice. An incorrect approach that focuses on theories lacking substantial empirical validation, or those that are purely speculative, would represent a regulatory and ethical failure. For instance, promoting interventions based on a purely wear and tear hypothesis without acknowledging the underlying molecular mechanisms would be a failure to adhere to evidence-based practice. Similarly, advocating for unproven anti-aging treatments based on fringe theories would violate ethical principles of honesty and non-maleficence, potentially leading to financial exploitation and harm to vulnerable older adults. Such approaches fail to meet the standards of professional competence and accountability expected of a specialist in gerontology. The professional decision-making process for similar situations should involve a critical evaluation of the scientific literature supporting any biological theory of aging. Professionals must ask, what is the empirical evidence for this theory? Has it been replicated? What are its limitations? Does it offer a testable framework for interventions? By prioritizing theories with strong scientific backing and critically assessing claims, gerontological specialists can ensure their practice remains ethical, effective, and aligned with regulatory expectations for evidence-based care. Question 14. During the evaluation of an older adult who expresses a strong desire to remain in their own home, despite recent falls and increasing forgetfulness, what is the most appropriate initial approach for a specialist in gerontology, CSG, to take? Option A. Focus solely on addressing the immediate safety concerns, such as installing grab bars and recommending a medical alert system, without delving into their cognitive status or broader living preferences. Option B. Conduct a comprehensive assessment of the individual's cognitive function, physical health, functional abilities, and home environment to identify specific risks and available supports, while actively involving the individual in discussing their preferences and concerns. Option C. Immediately arrange for a transition to a supported living facility to ensure their safety, as falls and forgetfulness are clear indicators of an inability to live independently. Option D. Respect the individual's stated wish to remain at home and defer any further assessment or intervention until a crisis occurs, to avoid causing them distress or infringing on their autonomy. The correct answer is B. Conduct a comprehensive assessment of the individual's cognitive function, physical health, functional abilities, and home environment to identify specific risks and available supports, while actively involving the individual in discussing their preferences and concerns. Explanation: this scenario is professionally challenging because it requires balancing the expressed wishes of an older adult with potential cognitive impairment against the duty of care and the need to ensure their safety and well-being. The gerontological specialist must navigate the complexities of autonomy versus beneficence, a core ethical dilemma in gerontology. Careful judgment is required to assess the individual's capacity to make decisions about their health and living situation, considering the potential impact of common health issues prevalent in older adults. The correct approach represents best professional practice because it prioritizes a comprehensive, person-centered assessment that respects the older adult's autonomy while also ensuring their safety. This involves a multifaceted evaluation of their cognitive status, functional abilities, and the specific health issues they are experiencing. By involving the individual in the decision-making process and exploring their preferences, the specialist upholds ethical principles of respect for persons and self-determination. This approach aligns with regulatory frameworks that emphasize person-centered care and the right of individuals to make informed decisions about their lives, provided they have the capacity to do so. It also acknowledges the importance of considering the social determinants of health and the individual's support network. An incorrect approach that focuses solely on the expressed desire to remain at home without a thorough assessment of capacity and safety risks would be professionally unacceptable. This fails to uphold the duty of care and could lead to neglect or harm, violating ethical obligations and potentially regulatory requirements related to safeguarding vulnerable adults. Another incorrect approach, which involves immediately overriding the individual's wishes and making unilateral decisions about their care or living situation, disregards the principle of autonomy and can erode trust. This can be seen as paternalistic and may not align with person-centered care principles. A third incorrect approach that neglects to consider the impact of specific common health issues, such as vision impairment or mobility limitations, on the individual's ability to live safely at home would be a failure to conduct a thorough and relevant assessment, leading to potentially unsafe recommendations. The professional decision-making process for similar situations should involve a systematic approach. 1. Initiate a comprehensive assessment that includes evaluating cognitive function, physical health, functional status, and psychosocial well-being. 2. Engage the older adult in open dialogue, actively listening to their concerns, preferences, and goals. 3. Identify specific common health issues that may impact their safety and independence at home. 4. Assess their capacity to understand the risks and benefits of their desired living situation. 5. Explore available support systems and resources that could facilitate safe, independent living. 6. Collaborate with the individual, their family, with consent, and other healthcare professionals to develop a care plan that balances autonomy with safety and well-being. 7. Document all assessments, discussions, and decisions thoroughly. Question 15. The risk matrix shows a moderate likelihood of increased social withdrawal and a low likelihood of heightened irritability in an 80-year-old client who has recently moved into assisted living. The gerontologist is considering how to approach this client's personality development in later life. Which of the following approaches best reflects a risk-informed, person-centered strategy? Option A. Initiate a series of structured social engagement activities tailored to the client's stated interests, while also observing for any signs of distress or further withdrawal, and documenting these observations for future review. Option B. Advise the client that increased social withdrawal and irritability are common and expected aspects of aging and require no further intervention. Option C. Immediately recommend a psychological evaluation to address the potential for depression or anxiety, given the observed changes in social behavior. Option D. Focus on cataloging the specific instances of irritability and social withdrawal to identify a definitive personality disorder diagnosis. The correct answer is A. Initiate a series of structured social engagement activities tailored to the client's stated interests, while also observing for any signs of distress or further withdrawal, and documenting these observations for future review. Explanation. This scenario presents a professional challenge due to the inherent subjectivity in assessing personality development in later life, particularly when it intersects with potential cognitive changes or established life patterns. The gerontologist must navigate the delicate balance between respecting an individual's autonomy and established personality, while also identifying potential areas of concern that might impact their well-being or social engagement. The risk matrix in this context is not a tool for definitive diagnosis, but rather a framework for structured observation and consideration of various factors that might influence personality expression and adaptation in later life. The correct approach represents best professional practice because it prioritizes a holistic and individualized assessment, grounded in established gerontological principles. It acknowledges that personality is dynamic and can evolve, but also that significant shifts or maladaptive patterns warrant careful, non-judgmental exploration. This approach aligns with ethical guidelines that emphasize person-centered care, respect for dignity, and the promotion of well-being. It involves gathering information from multiple sources, considering the individual's history and context, and employing a framework that allows for nuanced interpretation rather than rigid categorization. This fosters trust and ensures that interventions, if any, are tailored to the individual's unique needs and circumstances. An incorrect approach that focuses solely on identifying negative personality traits without considering the context or potential underlying causes would be ethically flawed. It risks pathologizing normal aging processes or misinterpreting coping mechanisms as inherent personality defects. This could lead to stigmatization and inappropriate interventions, violating the principle of beneficence and non-maleficence. Another incorrect approach that dismisses any observed changes as simply part of aging, without further investigation, fails to uphold the professional responsibility to identify and address potential issues that could impact quality of life or safety. This neglects the duty of care and could lead to missed opportunities for support or intervention. A third incorrect approach that relies on broad generalizations about personality in later life, without individual assessment, ignores the vast diversity within the older adult population, and is therefore unprofessional and potentially harmful. Professionals should employ a decision-making framework that begins with a thorough understanding of the individual's baseline personality and life history. They should then systematically observe and gather information about current behaviors and expressions, considering potential contributing factors such as physical health, social environment, and cognitive status. The risk matrix serves as a prompt to consider these factors in a structured manner. Crucially, any assessment must be conducted with empathy, respect, and a commitment to collaborative decision-making with the older adult, whenever possible. The focus should always be on promoting well-being and supporting the individual's continued adaptation and engagement with life. Question 16. Operational review demonstrates that an 80-year-old client with a history of type 2 diabetes and mild renal impairment expresses a strong preference for high-carbohydrate, low-fiber meals, despite physician recommendations for a balanced diet with controlled carbohydrate intake and increased fiber. The client's daughter is concerned about the client's adherence to any restrictive diet and believes the client should be allowed to eat what they enjoy. What is the most appropriate initial step for the gerontological specialist to take? Option A. Inform the client and daughter that the physician's recommendations must be followed strictly, regardless of the client's preferences, to prevent further health complications. Option B. Focus solely on educating the client about the long-term risks of their preferred diet without involving the physician or considering the client's current ability to change their eating habits. Option C. Conduct a comprehensive nutritional assessment. Consult with the client's physician to clarify the specific dietary recommendations and their rationale, and then collaboratively develop a meal plan that attempts to balance the client's preferences with medical necessity, exploring acceptable modifications and alternatives. Option D. Immediately implement the daughter's suggested approach of allowing the client to eat what they enjoy to avoid conflict and maintain client satisfaction, as adherence is a primary concern. The correct answer is C. Conduct a comprehensive nutritional assessment. Consult with the client's physician to clarify the specific dietary recommendations and their rationale, and then collaboratively develop a meal plan that attempts to balance the client's preferences with medical necessity, exploring acceptable modifications and alternatives. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the individual's autonomy and preferences with the need for appropriate nutritional support to manage age-related conditions and prevent complications. The gerontological specialist must navigate potential conflicts between the client's desires and evidence-based dietary recommendations, while also considering the practicalities of implementation within the client's living situation and the involvement of family or caregivers. Ensuring cultural sensitivity and respecting personal food choices are paramount. Correct approach analysis. The correct approach prioritizes a comprehensive, individualized assessment that integrates the client's medical history, current health status, functional abilities, cognitive function, and personal preferences. This aligns with best practices in gerontology, emphasizing person-centered care. Specifically, it requires consulting with the client's physician to understand the medical necessity of dietary restriction, assessing the client's ability to adhere to recommendations, and exploring acceptable alternatives that meet nutritional needs while respecting preferences. This approach is ethically sound, promoting autonomy and beneficence, and is supported by general principles of geriatric nutrition care which advocate for tailored interventions. Incorrect approaches analysis. One incorrect approach involves solely relying on the family's stated concerns without a thorough independent assessment of the client's needs and preferences. This fails to uphold the client's right to self-determination and may lead to interventions that are not medically necessary or are poorly tolerated. It also risks overlooking crucial information that only the client or a direct professional assessment can reveal. Another incorrect approach is to implement strict dietary restrictions based solely on general guidelines for age-related conditions, without considering the individual's specific medical diagnosis, current nutritional status, and potential for adverse effects. This can lead to unnecessary limitations, potential malnutrition, and a reduced quality of life. It disregards the principle of individualized care and the need for physician consultation. A third incorrect approach is to prioritize the client's immediate food preferences over established medical recommendations, even when those preferences could exacerbate existing health issues or hinder recovery. While respecting preferences is important, it should not supersede the professional's responsibility to ensure the client's health and well-being, especially when advised by a physician. This approach neglects the duty of care and the principle of non-maleficence. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a thorough assessment of the individual's holistic needs. This includes gathering information from multiple sources, client, family, healthcare providers, understanding the underlying medical rationale for any proposed interventions, and evaluating the client's capacity and willingness to participate in their care. Ethical principles of autonomy, beneficence, non-maleficence, and justice should guide all decisions. When conflicts arise, open communication, collaborative problem-solving, and a focus on the client's best interests, as defined by both medical necessity and personal values, are essential. Question 17. Regulatory review indicates that research into cellular senescence and the development of senolytic therapies is rapidly advancing. A gerontologist is presented with preliminary data suggesting that certain experimental senolytic compounds could potentially mitigate age-related functional decline. Considering the ethical and regulatory landscape for interventions targeting older adults, what is the most appropriate course of action for the gerontologist? Option A. Recommend that older adults participate in well-designed, ethically approved clinical trials investigating the safety and efficacy of senolytic therapies, while continuing to promote evidence-based lifestyle interventions. Option B. Advocate for the immediate use of experimental senolytic compounds in older adults, citing the potential for significant health improvements based on early research. Option C. Encourage older adults to independently seek out and administer experimental senolytic compounds obtained through unregulated channels, based on their personal interest in longevity research. Option D. Advise older adults to avoid any interventions related to cellular senescence until the research is fully mature and widely accepted by the scientific community, regardless of potential benefits. The correct answer is B. Advocate for the immediate use of experimental senolytic compounds in older adults, citing the potential for significant health improvements based on early research. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a gerontologist to balance the potential benefits of emerging cellular senescence research with the ethical imperative to protect vulnerable older adults from unproven and potentially harmful interventions. The rapid pace of scientific discovery in gerontology, particularly concerning cellular senescence, can create pressure to adopt new approaches before they are fully validated for safety and efficacy in a clinical setting. Professionals must navigate the line between innovation and responsible patient care, ensuring that decisions are grounded in evidence and patient well-being, not just scientific curiosity or commercial interests. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based decision-making, aligning with the core ethical principles of gerontological practice. Specifically, it adheres to guidelines that mandate the use of interventions with demonstrated efficacy and safety, particularly for older adults who may have comorbidities or be more susceptible to adverse effects. This approach respects the principle of do no harm and ensures that any proposed intervention, even one based on promising research like cellular senescence clearance, undergoes rigorous evaluation through established clinical trial pathways before being recommended or administered. This aligns with regulatory frameworks that govern the introduction of new therapies and the professional standards of gerontologists to act in the best interest of their clients. Incorrect approaches analysis. One incorrect approach involves immediately recommending or administering experimental senolytic therapies based solely on preliminary research findings. This fails to meet the regulatory requirement for evidence-based practice and ethical standards that demand proven safety and efficacy. It exposes older adults to unknown risks without adequate oversight, potentially leading to adverse events and violating the principle of informed consent, as the full spectrum of risks and benefits would not be established. Another incorrect approach is to dismiss all research on cellular senescence as irrelevant to clinical gerontology. This demonstrates a failure to stay abreast of scientific advancements and a lack of proactive engagement with potential future therapeutic avenues. While caution is necessary, outright dismissal can hinder progress and prevent the eventual development of beneficial interventions for age-related diseases. It may also contravene professional development expectations to remain informed about the field. A third incorrect approach is to advocate for the widespread adoption of lifestyle interventions claimed to target cellular senescence without robust scientific backing or clinical validation. While healthy lifestyle choices are generally beneficial, making specific claims about senolytic effects without evidence can mislead older adults and their families, potentially diverting them from proven health strategies or leading to disappointment if expected outcomes are not achieved. This approach lacks the scientific rigor required by regulatory bodies and ethical guidelines for health recommendations. Professional reasoning. Professionals should employ a decision-making framework that involves critical appraisal of scientific literature, consultation with multidisciplinary teams, and adherence to established ethical and regulatory guidelines. When faced with emerging research, such as that on cellular senescence, the process should include 1. Evaluating the strength of the evidence, e.g., peer-reviewed studies, clinical trial phases. 2. Assessing the potential risks and benefits for the specific older adult population. 3. Consulting with relevant experts and regulatory bodies. And 4. Prioritizing interventions that have undergone rigorous testing and demonstrated safety and efficacy. This systematic approach ensures that decisions are informed, ethical, and in the best interest of the older adult. Question 18. The evaluation methodology shows a gerontologist observing a group of older adults and categorizing their aging process based primarily on the presence of visible physical markers such as wrinkles, graying hair, and mobility limitations, while also noting their chronological age. Which of the following evaluation methodologies best reflects a comprehensive and ethical understanding of aging and the aging process? Adhering to best practices in gerontology. Option A. A methodology that prioritizes the assessment of cognitive function and memory recall, as these are the most critical indicators of successful aging. Option B. A methodology that relies on the subjective self-reporting of participants regarding their perceived age and the extent to which they feel they are acting their age. Option C. A methodology that integrates biological, psychological, and social domains, utilizing a combination of standardized assessments, qualitative interviews, and observation to capture the individual's lived experience of aging. Option D. A methodology that focuses exclusively on the rate of physical decline and the presence of age-related diseases, as these are the most objective indicators of aging. Correct answer is C. A methodology that integrates biological, psychological, and social domains, utilizing a combination of standardized assessments, qualitative interviews, and observation to capture the individual's lived experience of aging. Explanation. This scenario is professionally challenging because it requires a gerontologist to critically assess different methodologies for understanding aging, ensuring that the chosen approach aligns with best practices and ethical considerations within the specific regulatory framework governing gerontological practice. The core of the challenge lies in distinguishing between superficial observations and evidence-based, person-centered evaluations that respect the complexity and individuality of the aging process. The correct approach represents best professional practice because it prioritizes a holistic and multidimensional understanding of aging, acknowledging that biological, psychological, and social factors interact dynamically. This aligns with the ethical imperative to treat individuals with dignity and respect, recognizing their unique life experiences and needs. Regulatory guidelines for gerontological specialists emphasize evidence-based practice and client-centered care, which necessitates an evaluation methodology that captures the multifaceted nature of aging rather than relying on simplistic or biased interpretations. An incorrect approach that focuses solely on chronological age fails to acknowledge the heterogeneity of aging. This is a regulatory and ethical failure because it can lead to ageist assumptions and stereotyping, violating principles of non-discrimination and individual assessment. Another incorrect approach that prioritizes only observable physical changes overlooks the significant psychological and social dimensions of aging, such as cognitive function, emotional well-being, and social engagement. This is ethically problematic as it neglects crucial aspects of a person's quality of life and can lead to incomplete or inaccurate assessments. An approach that relies on anecdotal evidence or personal biases, rather than systematic data collection and analysis, is also a significant regulatory and ethical failure. It undermines the scientific integrity of gerontological practice and can result in misinformed interventions and recommendations, potentially harming the individuals being served. Professionals should employ a decision-making process that begins with clearly defining the assessment goals. They must then identify and evaluate potential methodologies against established gerontological principles, ethical codes, and relevant regulatory standards. This involves critically examining the evidence base for each approach, considering its applicability to diverse populations, and ensuring it promotes client autonomy and well-being. A systematic, evidence-informed, and person-centered approach is paramount. Question 19. Compliance review shows that a gerontologist has been working with an older adult who expresses a strong desire to remain in their long-standing home, despite evidence of significant environmental hazards including poor lighting, uneven flooring, and inadequate heating, which are demonstrably impacting the individual's mobility and increasing their risk of falls and respiratory issues. The gerontologist has noted the client's resistance to any suggestions of home modifications or relocation. What is the most ethically and professionally appropriate course of action for the gerontologist? Option A. Implement minor, non-intrusive environmental modifications without further consultation with the client, assuming these will address the risks and improve their comfort. Option B. Advise the client that their preferences regarding their home environment are not a professional concern and focus solely on their social and emotional well-being within the existing hazardous conditions. Option C. Immediately advocate for the client's relocation to a safer living environment, overriding their expressed desire to remain in their home due to the severity of the environmental risks. Option D. Initiate a collaborative process with the client and their family, with consent, to conduct a detailed environmental assessment, identify specific risks, and explore a range of feasible client-preferred solutions, including minor modifications, assistive devices, or alternative living arrangements if necessary, while respecting the client's autonomy throughout. The correct answer is D. Initiate a collaborative process with the client and their family, with consent, to conduct a detailed environmental assessment, identify specific risks, and explore a range of feasible, client-preferred solutions, including minor modifications, assistive devices, or alternative living arrangements if necessary, while respecting the client's autonomy throughout. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a client's expressed wishes and the potential for environmental factors to negatively impact their well-being and autonomy. The gerontologist must navigate the ethical imperative to respect client self-determination, while also fulfilling their duty of care to ensure safety and quality of life, especially when environmental influences are demonstrably detrimental. The complexity arises from balancing the client's current preferences with their long-term health and safety, requiring a nuanced understanding of environmental gerontology principles and ethical guidelines. Correct approach analysis. The correct approach prioritizes a comprehensive, client-centered assessment that explicitly considers the environmental factors identified. This aligns with best professional practice by acknowledging the interconnectedness of environment and aging. It involves a collaborative process with the client, family, with consent, and potentially other professionals to identify specific environmental risks and explore feasible, client-acceptable solutions. This approach upholds the ethical principles of autonomy by involving the client in decision-making and beneficence, by actively working to improve their living situation and well-being. It also adheres to the implicit regulatory framework that mandates professionals to act in the best interest of their clients, which includes safeguarding them from preventable harm stemming from their surroundings. Incorrect approaches analysis. One incorrect approach involves immediately overriding the client's wishes and initiating a move without thorough exploration of alternatives. This fails to respect client autonomy and can lead to distress, resistance, and a breakdown of trust. It also bypasses the crucial step of understanding why the client is resistant to change, which might reveal underlying fears or unmet needs that could be addressed through less drastic measures. This approach risks violating ethical principles of respect for persons and could be seen as paternalistic, potentially contravening guidelines that emphasize person-centered care. Another incorrect approach is to dismiss the environmental concerns as solely the client's preference, and therefore not within the gerontologist's purview. This abdicates professional responsibility. Environmental influences are a recognized determinant of health and well-being in gerontology. Ignoring them, especially when they pose a risk, is a failure to provide comprehensive care and could be considered negligence. This approach neglects the duty of care and the professional obligation to advocate for the client's holistic needs. A third incorrect approach is to focus solely on the client's immediate comfort without adequately assessing the long-term implications of the environmental issues. While immediate comfort is important, failing to address persistent environmental hazards like poor air quality or inadequate safety features can lead to chronic health problems, increased fall risk, or social isolation, ultimately diminishing the client's quality of life and independence. This approach lacks foresight and fails to proactively mitigate future risks, which is a core tenet of effective gerontological practice. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening and empathetic engagement to understand the client's perspective. This is followed by a thorough, evidence-informed assessment of the environmental influences and their potential impact on the client's physical, cognitive, and psychosocial well-being. The next step involves collaborative problem-solving with the client, exploring a range of options from minor modifications to more significant changes, always prioritizing the client's preferences and capabilities. Documentation of the assessment, discussions, and agreed-upon actions is crucial for accountability and continuity of care. This process ensures that interventions are both ethically sound and professionally responsible, respecting the client's dignity and promoting their optimal functioning within their environment. Question 20. Implementation of a comprehensive, patient-centered care strategy for older adults with co-occurring diabetes and heart disease, focusing on integrated management of both conditions and incorporating patient-reported outcomes and preferences into the treatment plan, is the most effective approach. Which of the following best describes an alternative approach that would be considered professionally suboptimal and potentially non-compliant with specialist in gerontology, CSG, guidelines? Option A. A strategy that primarily focuses on adjusting medication dosages for diabetes and heart disease based on routine clinical lab values and physician-led treatment protocols, with limited emphasis on patient education or lifestyle modification discussions. Option B. A strategy that empowers patients to actively participate in their care through shared decision-making, regular self-monitoring, and access to educational resources. Option C. A strategy that involves regular telehealth consultations with a gerontologist to monitor chronic conditions and provide ongoing patient education. Option D. A strategy that utilizes a multidisciplinary team including physicians, nurses, pharmacists, and dietitians to develop and implement a coordinated care plan. The correct answer is A. A strategy that primarily focuses on adjusting medication dosages for diabetes and heart disease based on routine clinical lab values and physician-led treatment protocols, with limited emphasis on patient education or lifestyle modification discussions. Explanation. This scenario presents a professional challenge due to the complex interplay of chronic disease management, the specific needs of an aging population, and the regulatory landscape governing gerontological care. Ensuring optimal patient outcomes requires a nuanced understanding of individual patient conditions, adherence to evidence-based practices, and strict compliance with the specialist in gerontology, CSG, regulatory framework. The core difficulty lies in balancing proactive disease management with the autonomy and preferences of older adults, all while navigating the specific legal and ethical guidelines of the CSG. The correct approach represents best professional practice because it prioritizes a holistic, person-centered strategy that aligns with the CSG's emphasis on individualized care plans and interdisciplinary collaboration. This approach acknowledges that chronic diseases like diabetes and heart disease require ongoing monitoring, patient education, and coordinated efforts from various healthcare professionals. By integrating patient-reported outcomes and preferences into the care plan, it upholds ethical principles of autonomy and beneficence, ensuring that interventions are not only clinically sound, but also aligned with the patient's values and goals. This proactive and collaborative model is directly supported by the CSG's mandate to promote the highest quality of life for older adults. An incorrect approach that focuses solely on medication management, without considering lifestyle modifications or patient engagement, would fail to meet the comprehensive standards of gerontological care mandated by the CSG. This oversight could lead to suboptimal disease control and potentially adverse health events, violating the ethical duty of care. Another incorrect approach that relies on a single discipline's assessment without consulting other relevant specialists, e.g., a cardiologist solely managing a diabetic patient's heart disease without input from an endocrinologist or a dietitian, would contravene the CSG's requirement for interdisciplinary teamwork, potentially leading to fragmented care and missed opportunities for synergistic treatment. A third incorrect approach that prioritizes cost containment over evidence-based interventions, even if compliant with general healthcare budgets, would be ethically and regulatorily unsound under the CSG framework, as it could compromise patient well-being and access to necessary care. Professionals should employ a decision-making process that begins with a thorough assessment of the individual's chronic conditions, functional status, cognitive abilities, and personal preferences. This assessment should then inform the development of a multidisciplinary care plan, developed in collaboration with the patient and their family, and in strict adherence to CSG guidelines. Regular review and adjustment of the care plan based on patient progress and evolving needs are crucial. This iterative process ensures that care remains person-centered, evidence-based, and compliant with all relevant regulations.